You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, Dr. Jeffrey Mader. Dr. Mader, welcome to the program.
Thank you, Randy. It's great to be here.
Good. Now, I know you brought a lot of photos, so we'll try to get to as many of those as we can. Now, for people that don't know you or know your practice, who's the typical implant patient that you see?
So we see a big variety of patients every day. We've got patients who are professionals, lawyers, attorneys, doctors. We've got Notre Dame professors.
Okay.
We've got small business owners who maybe in the morning I might see the owner of a factory making RVs in Elkhart, Indiana. And that afternoon I might see the welder who works at that gentleman's factory in Elkhart, Indiana. So we have a really diverse group of people that we see. But they all seem to have the same problem. They've been faced with a lifetime of dental challenges.
Okay.
So we've got patients that are on the verge of losing their teeth and they don't want to have a denture. And then we've got patients that have been wearing dentures for a long period of time and they're really unaware of all the things that we can do to give them a permanent set of teeth again.
Okay. Now, especially in South Bend, I mean, you are the go-to center for implant dentistry, but I guess people across the state, even neighboring states, are going to you for this.
Well,
is that right? Is that true?
That's nice of you to say. We work hard at really providing great service. And we help people in the northern part of Indiana and the southern part of Michigan. So we're called Michiana. That's the name of our community.
All right.
And we've got people who travel to see us quite a bit. We want to get the word out. So we let people know that we're here to help them through TV, radio, billboards. We've been doing those ads for a long time, trying to let them know what our services are.
So a lot of people have seen you because you have a billboard, you've got a lot of short commercials, so they're finally going to get a chance to meet you, I guess.
Finally, yes.
On this program today.
I'll see people at the grocery store while I'm checking out, and they're like, "Now, how do I know you? I've seen your face somewhere before." And then we have a nice conversation, and I encourage them to come in and see us. Because so much has happened in the world of implant dentistry in the last even 10 years.
So no more dentures. Is that the truth? I mean, is that the future of dentistry, I should say?
You know, people who are, it is the future of dentistry. And there's no reason in today's world that people should have to wear a denture. You know, George Washington used to go to work on a horse wearing his dentures.
Yeah.
Well, we don't go to work on a horse any longer. And yet people are still thinking, they still think that dentures may be the only option. So a lot of the people that I see are people who are coming to me for a second opinion. Maybe they had heard about implants, they know that we do these, and they want to know what their options are, because maybe the only option that they've been given is to have all their teeth taken out and have a set of dentures made. And then you've got this group of people that have been suffering so long wearing dentures. And I think there's a myth out there that you have to have all of this bone to be able to do dental implants.
Yeah, but isn't it true? I mean, if you've been wearing a denture for like 20 years, you can't do this, not enough bone.
That's not true.
Okay.
It requires very little bone to be able to secure the implants in place. It only takes 9 millimeters, you know, that's this much. So a very small bone, we can still place multiple implants and give someone a set of teeth that they can chew with, they can smile, they can kiss their spouse, they can eat whatever they want without thinking about it. So people have been told, I think at other offices, that there's not enough bone to have implants placed.
Patients tell you that?
Patients tell me that. And with the technology that we have today, with the techniques, with the protocol that we use called hybrid, very little bone is required to have implants placed.
How old can you be to do this?
You can be 99 years old.
Okay. Yeah, but why would a 99-year-old want to do this?
Well, why wouldn't they want to do it, Randy? Why wouldn't you spend the last couple of years of your life being able to eat what you want, smile what you want?
Good point.
You know, I have patients come in that are 60 years old, and I tell them the options that they have available. They're like, I'm too old for that. And then I have people who are 70, and they come in, and they say, I'm too old for that. People that are 80, that are 90. And the patients that finally accept treatment, they all tell me, I should have done this years ago.
Is that right? What's your oldest patient that you gave him a brand new set of teeth for?
89 years old.
Is that right?
Yeah. An awesome lady. And she was faced with losing all her teeth. She had worked really hard to keep her teeth all of her life. Was finally at the end game of her teeth. And she just thought, there's no way. I've seen too many of my friends suffer with dentures. And she did not want to go down that road. So she's got a full set of teeth that don't come out, and she's just a lovely, lovely lady.
And they can eat whatever they want, or they got to take it easy?
So picture yourself as a denture wearer, and you're going out to dinner with some friends, and you get the menu in front of you, and you've got to peruse the menu and try and find out what you what you can eat. And maybe it's spaghetti or a bowl of soup. So I think those are the experiences that this patient had with many of her friends and said, I don't want to go down that path.
I want to ask you, I mean, where you are in Indiana, I mean, are there a lot of people wearing like an upper lower denture or headed to dentures? Is it a big problem is my question.
I see it every day. I think you could take all the people in northern Indiana and southern Michigan who are either faced with losing their teeth on their way to a denture or are wearing dentures, and you could fill up the Notre Dame Stadium.
Is that right?
There are tens and tens of thousands of people who suffer with this.
So if it's so good and there's so many people doing it, why aren't they all coming in to get new teeth with dental implants?
What's your take? There's a couple of, my take is that once you have a denture, you've kind of closed that chapter on your life, and you never want to have to go back to the dental office again.
Okay.
Maybe you have got a sore spot and you need a reline or something, and that's just an inconvenience. But you suffer along with dentures because you think that's your only option. Then you've got patients that know they're at the end of the life of their teeth. And Randy, let me tell you a little bit about what it was like for those people who've spent 50 years of their life trying to keep their teeth.
Okay.
So you've got an awesome smile.
All right, thank you.
So you're blessed with
lucky,
good genes. You probably grew up with some fluoride in your water, and you take your teeth for granted. You probably I'm sure you go to the dentist regularly, but your dentist is probably like, Randy, see you in 6 months. Everything looks great. Well, there are patients out there who have never heard that from their dentist. All they hear is, okay, Sally, we've got a root canal to do, or we're going to lose this tooth on the lower right. Boy, your gums are in trouble. I need to send you off to the periodontist. You need a root canal. That's what people hear every time they go to the dentist. And they have spent so much of their time, so much of their money trying to keep their teeth. And it's an endless battle. There are patients who may have had one bad experience in the course of their life as a child. Patients who are 80, imagine what dentistry was like when they were 10.
Yeah, good point. Okay, wow.
Half of them had a terrorist for a dentist. Novocaine hadn't even been invented yet. It was a horrific experience.
So it's hard to get them back in, right?
So they don't want. So the patient who's a denture wearer now does not want to come in because they've closed that chapter of their life. They think, okay,
last thing they want to do is see you.
Done with dentistry.
Okay, so the first group of people, the denture wearers, they don't go to the dentist, so they don't know their options. Yeah, they don't come in to get implants.
So they come in when they've got maybe a sore spot somewhere, and I'll say, hey, how are you doing with their dentures? And they give me they're not too happy. Let's just say that. And I say, can you eat the foods you want? Can you laugh without thinking about it? Are you worried about them loosening? If you're a denture wearer, the first thing you do when you wake up in the morning is fill the inside of your denture with a bunch of gooey, sticky glop called adhesive.
Is that right?
And you can't get through a night of television without seeing a Fix-It-In commercial.
Okay.
It's a $1 billion industry to try and have people hold their dentures in place. So they suffer with that. And I've got patients whose spouse don't even know that they wear dentures. I mean, They would be horrified if they knew that they wore dentures. So it's kind of a tiny little secret that they keep. But imagine you wake up, you put this gooey stuff inside your teeth, you pop it in, and you can get through breakfast okay. Scrambled eggs are a piece of cake. But maybe you're going to get a text from your friend that says, hey, why don't we meet for lunch? And you go to lunch, and again, you're looking at the menu, and you're thinking, well, I can't eat a grilled chicken sandwich. I can't have the turkey sandwich. I can't have anything that I have to bite into.
At least to be able to eat in front of your friends.
Exactly.
Okay.
So maybe you get the soup. Maybe you get some gooey tuna fish sandwich on a croissant, something soft that you can eat. And then you're halfway through lunch and you got some food stuck underneath your denture and it's killing you. You can't even continue on the meal. Okay. So you've got to make up a story that you're going to go to the bathroom. Now you're in the bathroom and you're cleaning out your denture and you're praying
this goes on?
This is a daily occurrence.
Okay.
So they're cleaning their denture out and hoping nobody comes in, because that's the last thing you want to be doing is get caught cleaning your denture out. So you make it through lunch, and then your friend says, hey, why don't we get together with our husbands tonight and have dinner? Or come on over for a barbecue. And you're like, okay, sounds great. And you show up, and there your friend's grilling some steaks on the grill. And there's no way you're going to get through that. So people, they make decisions in their daily planning whether or not they're going to be able to get through it because they wear dentures. And the foods that they eat, the gatherings that they go to, are really ruled by having to wear a denture. But Randy, that's all changed. There is no need for anybody to wear a denture any longer. With dental implants, you can have a permanent set of teeth that don't come out. And again, you eat what you want. You're going to be the one making the steaks on the grill at your house.
Okay.
So it's a game changer for people, and it's a life-changing event.
So even if you're like 70 or 80, which 80 is kind of young today, they're not more likely to fall out, these dental implants?
So the amount of bone, that's another myth, is that, maybe their physician is telling them they've got osteoporosis or your bone isn't as strong. You know, women are always getting their bone scans done and they're not getting good news. So the jawbone is actually exempt from those things. So we're able to do implants on just about everybody. And it takes very little bone to be able to accomplish that. So that's a myth.
Now you're known, I guess, for sedation. So these people come in, and you said that, like, you give them a brand new set of teeth. Like, they walk in with no teeth, they walk out with teeth that don't come out, and they have like no memory of the procedure, or very little.
Yeah, it's amazing.
Is that true?
So, well, you think in healthcare, you know, every healthcare procedure that you have done, are you going to have a colonoscopy without being sedated? No way. Are you going to have a vasectomy without being sedated? No way. So every minor healthcare procedure that's done, we just assume, well, we're going to be sedated.
Yeah.
And yet in dentistry, we expect patients to lean back in this vulnerable position and sit there and take it for 45 minutes.
Like torture.
It's for some people, it's awful. And it reminds them of childhood memories, and it's a huge hurdle for people to try and get over. Some people, making that phone call is an emotional event.
Really?
You know, so just picking up the phone and calling our office takes every ounce of courage that they have. And they come and they meet us for the first time, and we've got a strategically placed box of tissue in the room where we meet, because it's a very emotional experience. So there's a big group of people who end up being close to denture wearers because they just can't get to the dentist. They're totally afraid. They're scared to death. And so
that's kind of like what you deal with, right? I mean, that's your specialty.
Every day we sedate several people, and we can get them the smile that they want without them being an active participant. So we send them off to La La Land. We get them all taken care of, and we can either get, if implants is the procedure that they need, then that's what we do. Maybe it's just some basic dentistry. We can do all of this under IV sedation.
So you brought some photos. What are we looking at?
I can't wait to show you these, Randy. This is Nancy.
All right.
Wonderful lady in her mid-80s. She'd worked hard her whole life to keep her teeth. And I can't wait to show you this after shot, by the way. Really, you know, reasonable smile to start with, but she was at the end of her game, and she needed to have her teeth removed. So we gave her the option of doing a full set of upper and lower implant retained teeth. These never come out. She chews what she wants. She smiles big. She's a very social lady, and she's so happy now. She goes to lunch with her friends and orders whatever she wants. She smiles. She's got grandkids. You know, grandchildren are amazing. There is no hesitation when they say, "Hey, Grandma, how come your teeth are so dark?" Or, "Grandpa, how come you're missing that tooth there?"
Okay.
You know, so they're very honest souls. And Nancy's just a fantastic lady. Again, in her mid-80s, and she said, "I do not want." She intends to live 100 to 100.
Okay.
She's like, "I'm not spending the next 15 years of my life taking my teeth in and out." So, Randy, take a look at this lady's smile. Does that look fake to you?
No.
Do those
good.
teeth look like they come out at night?
No.
So that's by design. Those teeth, we spent a lot of time studying a patient's face and giving them a smile that complements the face. So the teeth shouldn't be the first thing that you see when she smiles. It should just complement her face. And you look at Nancy and you say, wow, here's a fantastic looking lady.
Yeah.
So take a look at how the edges of her teeth follow her lower lip. We gave her a little pointed cuspid on her right side.
Like the canine teeth?
Yeah.
So they're pointed on purpose.
It's a youthful smile.
Okay.
So nothing like a worn set of teeth to age a person. And if you look at a 14 or an 18-year-old, they've got little pointy cuspids. So we added that little feature to Nancy. And of course, she was able to look at all of this in advance and say, Jeff, I love this. I love this. I love the shade. I love the length. I love the little tweaks that you put in there.
So they're in on how it's
Totally.
going to look.
They're an active participant of what their smile is going to look like. So I've got patients who, they want Hollywood white. Right. We give them Hollywood white. Okay. We've got patients who want age-appropriate teeth. And we've got patients right in the middle. So, I've never given a patient white teeth and they've said, they're too white.
Okay.
They just don't say that. They're like, wow, look at that smile. One of the greatest moments for me every day is when I hand the patient a mirror. And it's that first moment, they've got their new set of teeth.
Yeah.
I hand them that mirror. I've got the box of tissue ready because remember, this has been an emotional journey for these people right from day one. They've suffered with bad teeth their whole life, or they've been wearing a denture they can't tolerate. And this is a great moment. And we put these teeth in, and the first thing they always say is they put their tongue up there like, hey, I can feel the roof of my mouth again. And wow, this feels really natural. I don't have all this bulk and stuff in there. And we hand them in the mirror, and it's usually about 2 seconds before the eyes well up and the tears come down. And I'm secretly hoping for a hug. You know, that's when I know I hit it out of the park.
Do they hug you?
You know, when I've got a 60-year-old man, rough and tough guy, and he comes up and gives me a bear hug, you know, I know I did a great job for him.
That's good. And so how soon can you eat? After the procedure?
So you can eat that afternoon. You know, Randy, this is designed to happen fast. People are busy in their lives. What often takes 6 to 12 months in other offices, because of the training and level of training that they have, we're able to do in weeks, 2 to 3 weeks.
Okay. So if somebody's watching this and everything works out
next month, they've got a new smile.
They have a brand new set of teeth.
New set of teeth.
Now what if you have, and we have to take a break in a second, but what if you have really bad teeth? If you have periodontal disease or gum disease? Gums are too bad for this?
Just about everybody's got gum disease. It's the most common human ailment.
Okay.
But gum disease affects teeth. It doesn't affect bone. So once the teeth are removed, you've got strong bone that you can place implants in and attach a permanent set of teeth to.
So you clean up the gums.
So all that infection is gone. You know, there's been a huge link between gum disease and diabetes, between gum disease and heart disease. I am amazed when people come in and they've had bad teeth, they have infected, painful infections going on within their teeth, and we get them clear of that infection. They just say, you know, doc, I just feel better. I can't put my finger on it, but I feel healthier. And it's because their immune system isn't working overtime trying to clear up this low-grade infection that's been going on in their body for 35 years.
All right, now we're going to take a quick break. And I know you have more photos, and some of these are very dramatic. When we come back, also the process, what people can expect on day one. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
They did the dental implants, but it was pretty straightforward. I mean, it was just like having a filling, really. It wasn't painful. You know, obviously it takes time before it was healed to have the tooth, but that was a great outcome. Painless, you know, great engineering, and it stood the test of time.
I come to find out Dr. Mader done everything right in his office. And I felt confident that they were going to be the one that was going to do my mouth. And I came in that day, I sit down, I talked to Leanne again. They still welcomed me, they knew my name. And I went on, I done it. And I don't regret it.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have Indiana's implant dentist, Dr. Mader. Dr. Mader, welcome back.
Hey, Randy.
You've already showed us a lot of photos.
I got to show you more.
Okay,
so
and for people just tuning in, I mean, literally, you can walk in with no teeth in your office on the day of the procedure and walk out with teeth.
You can.
Supported by implants that don't come out.
Yep, 3 weeks start to finish.
Or you can have really bad teeth, extract the teeth, and also get brand new teeth in the same day and walk out.
Exactly.
Is that right?
And you're having lunch that afternoon. So it's the protocol has been refined and so advanced, and with the technology that we have embraced, really.
Okay.
So this hybrid protocol, I've searched the country to try and find a protocol that I felt was the best, because there are different brands of this out there, and I feel that you can't beat a hybrid smile.
So when you're going to a dentist to do this, I mean, ask them, do you follow this hybrid system?
Yeah, it's an incredible protocol.
Because it's a faster way to do it.
Happens quickly, and the long-term studies support great long-term health with these implants.
So let's take a look at some of these.
So here's Karen. So Karen came into me. She knew that she was at the end of her game. She had to have her teeth removed, and she went to another office. They told her she had to have her teeth removed, have dentures placed. Came to me for a second opinion. She couldn't eat. She was in pain. Had suffered from gum disease, tooth decay, all the things that the average person that I see suffers from.
Do they come in? I'm sorry to interrupt, but do they come in sometimes and say, "Look, I don't want a denture. I want teeth that don't come out.
Absolutely, because they know someone, maybe their grandparent, they saw their grandparents suffer with dentures. They have a friend. They know, plus in today's world, they know it's antiquated treatment. No one should have to wear a denture.
Okay.
And so in a very short amount of time, she gets a brand new smile. She was so happy, so excited.
She looks happy.
And Karen now is lighting up the world. I mean, when I see her come in for a follow-up check, I get a hug right away. Big smile. She tells me about her life and what an awesome decision it was for her. Let me tell you about Darlene.
All right.
Beautiful lady, happy lady, just wanted to be more social.
Okay.
She felt she had to cover up her smile, and it's amazing how expert people can become at covering up their smile, whether they cover it up with their hand or their lip, covers up their teeth. She's very involved in her church. And just wanted to be even more involved in. So she went to another office and was told that a denture was her only option. And I agreed she had to have her teeth removed. And she thought, there is no way I'm having a denture. She's got too much life left inside her to be taking her teeth out at night. And she had a long history of trouble with her teeth. So in one afternoon, we were able to give Darlene a brand new smile. And so
nice.
Excited.
Very nice.
Super happy lady.
What do they like more? That they can eat whatever they want, or do they like the way it looks? Or a combination of both?
It's funny, Randy, you ask that, because people have expectations in their mind. So I have patients who come in and they're like, my son's getting married in 4 months and I got to have a smile. Or my daughter's getting married, I'm going to be giving the toast. So a patient may come in and say, I'm really just worried about the aesthetics and my smile, and not really care much about chewing. And I had one patient who was all fired up to give this great toast, but he said, I'm so worried about my denture coming out while I'm in the middle of this thing. I don't know how I can get through this. The video camera is going to be on him. All of his friends and family are there. So his motivation was to have a great smile, not really worried too much about what he could eat. And we gave him a great smile. He gave a fantastic toast. I was asking him about the wedding, and he said, I was really motivated to do this just for the aesthetics of it all. But I sat down at the dinner at my daughter's wedding, and we served steak, and I was able to eat it in under 30 minutes. I've got patients who come in, and they're just worried about how they can chew, and they can't chew. They can't eat corn on the cob. They can't eat a steak. And so that may be their driving force.
Yeah.
And we give them a set of teeth that they can chew with. But then they come in and they're like, wow, my smile looks fantastic. I get compliments all the time on my smile.
Okay.
And it becomes a life-changing event for them. So, it's a little tiny secret that people wear dentures. And you would be amazed. Again, we've got a Notre Dame stadium full of people who are suffering with this. And the changes that it makes in a person's confidence, in their self-esteem. A smile it's part of someone's success, part of their self-esteem, it's part of their social interaction.
And their charisma, right?
For sure. So if you're embarrassed about your teeth, you're going to become withdrawn. You're going to alter your social schedule.
So do
to
something
fit around
about
your
it.
back teeth.
That's
Absolutely.
your message.
For sure.
Okay, time for a
Let me
couple
show
more
you-
photos.
Let me show you Carla.
All right.
Take a look at Carla. She was actually putting wax on her teeth to try and cover up her bad teeth. What a gorgeous person now. Look at that smile. And this was actually day one of her new smile when this picture was taken. And she still wasn't even used to it. I'm like, smile, Carla, smile. And so what a game changer for her.
Do they start taking selfies and posting them on Facebook and Instagram?
They can't get enough of themselves.
Okay.
Here's Tammy. Again, suffered a childhood injury from playing sports, was faced with losing her front teeth, and elected to have dental implants, and now she's got this gorgeous smile. Look how her teeth complement her smile. All the smile analysis that went into the pre-planning of this to give her a gorgeous smile.
Good.
So here's Jeff. Jeff was on a mission to get married within a year.
Okay.
And 6 months after his new smile, he's engaged.
Good story.
So love it. Here's Rodney. Rodney had a denture. Take a look at his smile, his before photo. He is this happy, gregarious guy who's holding back on his smile.
Can't see his teeth.
And can't see his
Almost.
teeth. He's learned how to cover up his teeth. So Rodney's only option was a new set of dentures. He was wearing a denture right now, which was worn. So here's a patient who'd been wearing a denture for a long time, and we were able to give him a permanent set of teeth.
A brand new set of teeth. Yeah. Now, you were saying sometimes on the consult, you get excited because you're going, this is going to be good. Like, the patient doesn't even know how good it's going to be.
They don't.
There's truth to that.
Yeah, so our goal is to exceed their expectations. That's our goal. And when patients, they don't realize because they've suffered, we accommodate as human beings.
What do you mean?
If we lose a pinky, we can still get on with life. We accommodate to that. But all of a sudden, if you can get your pinky back,
it's a big deal.
It's a
Okay.
big deal. It's
Yeah,
like, would you ever have a little cut on your finger and you have to alter everything that you do? But you accommodate to it. So patients learn how to deal with bad teeth or loose-fitting dentures. But when we reverse all that, when they get their smile back, when they get the ability to eat what they want, kiss their spouse, be out in the public, interacting with people socially, it's a complete game changer for them.
Yeah, but now we have to mention that even with the best dental insurance, dental implants are only a very small portion is covered. Medicare, Medicaid doesn't cover it at all.
Yeah, there's ways to finance this. So if you've
Are
got
people financing
if you've
it?
got decent credit, the majority of my patients do this. This is not something that you budget for, and you finally commit to doing this. We've got ways to make that happen. We're trying to get over that. We do not want the dollar to be the obstacle to getting this treatment.
Okay, good. Time for a couple more photos, and I'm sorry to rush you. But
Yeah,
we have about a
so-
minute left at the most.
There's Val, a professional in town. Again, was faced with losing her teeth. She'd been wearing a partial for a long time. She had a bridge that was failing. So this is a person who'd been to the dentist a zillion times and spent a fortune on her mouth already, and knew that she was faced with losing her teeth. And she wanted to have a lifelong battle finally end and not go the route of dentures. So she's got a gorgeous set of upper and lower teeth now that she has
And
great
they can eat
confidence.
whatever they want.
Eat whatever they
You
want.
said they can eat right away.
smiles, right away. That day.
You must tell them to take it easy a little bit at the beginning.
You might not want to go to Ruth Chris and order a sirloin the first afternoon, but the implants become very strong in a very short amount of time. So.
Okay, good. Well, look, final message. We're out of time. Somebody watching this, they're of the two groups. Really bad teeth, they're headed for dentures, they don't want dentures, or the denture crowd, which you say is hard to get in because they've adapted. But let's say they've heard what you had to say today and they're still afraid or skeptical or think they're too old or whatever. What do you say to them?
I invite them in. Say, let's chat. Let's just have a conversation. We do a free CT scan at our initial consultation. And again, 99 out of 100 people can have this type of treatment. And there is no reason for a person who's wearing dentures to continue the rest of your life being faced with that.
Do they get to see you on the consult?
Of course.
Because you're pretty big in Indiana,
On the
right?
face, yeah, of course.
So you see with the patients?
Yeah.
And you love it.
I'm so passionate about it. I'm so fortunate because I get to do what I'm passionate about, and I get to do what I'm good at. And putting those two together doesn't happen very often.
Okay, good. I want to thank you for coming on the show. Good
Yeah,
stuff.
Randy,
Good
it's
stuff.
really a pleasure talking to you.
So they could go to the website, look at some of the photos,
Yep.
schedule a free consultation.
We'll get you in that week.
Go from there. Thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.